Hello and welcome. Today we're diving into a rare and fascinating eye disease, Ligneous Conjunctivitis. This condition, characterized by thick, woody membranes forming on the conjunctiva, the clear membrane covering the white part of the eye and the inner surface of the eyelids, can be quite debilitating if left untreated. Join us as we explore its causes, symptoms, diagnosis, and management. The primary cause of Ligneous Conjunctivitis is a deficiency in a protein called plasminogen. Plasminogen is crucial for breaking down fibrin, a protein involved in blood clotting and wound healing. When plasminogen levels are low or absent, fibrin accumulates excessively. This buildup of fibrin leads to the formation of those characteristic ligneous, or woody, membranes we see in this disease. The plasminogen deficiency is typically caused by a genetic mutation affecting the PLG gene, which provides instructions for making plasminogen. In rare cases, Ligneous conjunctivitis may be associated with other systemic diseases or occur spontaneously without a clearly identifiable genetic cause. Let's delve a bit deeper into how this disease works. The deficiency in plasminogen disrupts the normal process of fibrinolysis, which is the breakdown of fibrin. When fibrin isn't properly broken down, it accumulates and organizes into dense, amorphous, eosinophilic deposits. These deposits then form the pseudomembranes, often described as woody or ligneous in texture, on the conjunctival surface. The accumulation can lead to inflammation, scarring, and ultimately impaired vision if left untreated. The lesions are not exclusively found in the eyes. It could also occur in other mucous membranes such as gums, larynx, trachea, respiratory and gastrointestinal tract. Ligneous conjunctivitis is considered a very rare disease. Precise prevalence figures are difficult to obtain due to its rarity and potential for misdiagnosis. It affects both males and females equally, and while it can manifest at any age, it's most commonly diagnosed in infancy or early childhood. Due to its genetic basis, there may be a higher prevalence in populations with a higher rate of consanguineous marriages, where there is a greater chance of inheriting the mutated PLG gene. The hallmark symptom of Ligneous conjunctivitis is the formation of thick, firm, woodish yellow membranes on the conjunctiva. These membranes can cause significant discomfort, including redness, tearing, foreign body sensation, and photophobia or sensitivity to light. In severe cases, the membranes can lead to corneal involvement, causing blurred vision or even visual impairment. Beyond the eyes, ligneous lesions can also occur on other mucous membranes, such as the gums, larynx, or trachea, leading to related symptoms like difficulty breathing or hoarseness. Diagnosing Ligneous conjunctivitis requires a thorough clinical examination by an ophthalmologist. The presence of the characteristic ligneous membranes is a key indicator. A biopsy of the conjunctival membrane is typically performed to confirm the diagnosis and rule out other conditions. Histopathological examination of the biopsy specimen will reveal the presence of amorphous eosinophilic material consistent with fibrin deposits. Furthermore, blood tests to measure plasminogen levels are essential. Genetic testing can also be performed to identify mutations in the PLG gene, further confirming the diagnosis and providing valuable information for genetic counseling. While Ligneous conjunctivitis isn't typically divided into distinct types, its severity can vary significantly from mild cases with small, localized membranes to severe cases involving extensive conjunctival involvement and systemic manifestations. The age of onset can also be a factor. Early onset cases tend to be more severe. Some researchers divide the disease based on whether it is localized to the eye or involves systemic involvement, but this is not a formal classification system. Treatment for Ligneous conjunctivitis is multifaceted and aims to reduce inflammation, remove the membranes, and prevent recurrence. Topical treatments include corticosteroids to reduce inflammation and heparin or other fibrinolytic agents to help dissolve the membranes. In some cases, surgical removal of the membranes may be necessary, although recurrence is common without additional treatment. Systemic plasminogen concentrate therapy has shown promise in treating both ocular and systemic manifestations. Immunomodulatory therapies, such as cyclosporine, may also be used to reduce inflammation. For individuals with a documented genetic mutation, genetic counseling is recommended to inform them about the inheritance pattern and potential risks for future offspring. Unfortunately, as Ligneous conjunctivitis is primarily caused by a genetic mutation, there is no specific way to prevent its occurrence. However, genetic counseling and testing can play a role in identifying individuals at risk, especially in populations with a higher prevalence of the disease. Early diagnosis and prompt treatment can help minimize the severity of the disease and prevent long-term complications. The prognosis for Ligneous conjunctivitis varies depending on the severity of the disease and the effectiveness of treatment. With prompt and appropriate management, many individuals can achieve significant improvement in their symptoms and prevent vision loss. However, recurrence is common, and long-term follow-up is essential. Recent research has focused on developing more effective therapies, including gene therapy approaches to correct the underlying plasminogen deficiency. Further research is needed to fully understand the pathophysiology of this rare disease and develop more targeted and effective treatments.